We are live, sir.
Right. So, good morning to all of you. And today we have a privilege that uh, Dr. Pranjali is with us. And guys, for your surprise, she has secured rank 35 in NEET PG 24. So, such an amazing rank. A big congrats to Dr. Pranjali, to you. And
Thank you
welcome
so much, sir.
Welcome to the Zoom meeting. And thanks for sparing so much of time. I know you are busy today and you must be getting so many phone calls and getting the messages for the congrats and all. So thanks for sparing this a few minutes for us.
No, sir, my pleasure, my pleasure.
Right.
Actually, I would love to give the huge credit to Dr. Bhatia team because I have been student of Dr. Bhatia since 2020, since my second year, second prof. And I
Okay.
have and I have done almost all of my subjects from Dr. Bhatia, and I have read their notes. I have done all my preparation from them. So I think a huge credit goes to the Bhatia team.
I don't know. Thanks for this honor to Dr. Bhatia. So being as a part of Dr. Bhatia Medical Institute, so I just want to say thanks for this compliment that you have given to us. But Dr. Pranjali, this I would not like to take the credit out of you. This is all your hard work, all your focus for this exam that you have secured such a good, amazing rank.
Thank
So
you so much, sir.
first of all, like how are you feeling right now? I know you are on the cloud nine right now, but still, I may just want to listen from you.
Sir, actually, yesterday when the rank list PDF came and I saw my rank, I was not believing it. I called my parents. I sent them the PDF that please ensure that this is my rank only. So since then, I am getting goosebumps. I was not able to sleep the whole night, and I
And
was constantly checking my phone that this is not a dream. This is truth. This is truth.
this
It took me a
happens.
long time. So right now, I am still settled, but I'm still very happy because I have worked hard a lot for it.
Yeah,
So
we can
seeing it
understand.
coming true, it is very good. It's a very happy moment for me, very proud moment.
So, like Dr. Pandey, you just mentioned, like the moment you've seen your rank on this PDF and you shared with your parents.
Yes,
So,
sir.
like when you got this rank and when you were when you checked your result, at that time you were not with at your home or you were somewhere else.
No, sir. Actually, after INI result came, so after the NEET, I joined AIMS Batinda, Ops Gynae,
IMS
through
Patiala,
INI.
okay, okay,
Yes, sir. So I had just came from my duty. I was in my room. I just come from the duty. I was having dinner instead. Actually, I was just having dinner, and my message popped up on my phone that the result has come.
okay.
So that was the time.
So, Dr. Pranjali, actually, what's your dream branch? Is it Ops Gynae or something else?
So the thing is that yeah, I had always been confused between uh because the thing is that one there is a love that is for ops gynae,
Okay.
but there's also some views like there's a comfort and other thoughts start coming to
Yeah.
you that some branches are more comfortable and better, easier. So that is the thing. But my inclination has always been towards ops gynae.
Towards house gynae. So now you have got rank 35. Now all the options are open for you.
Yes,
So
sir.
now if you get a chance to switch to any other branch, so that branches would be
Sir, I would be considering radiology or dermatology.
okay, radiology and dermatology. So totally a different, like the ops gynae is so
Yeah,
much.
exactly. Exactly. That's why I'm very confused. I'm still thinking. I am starting to think that I'll consult my teachers in
Yeah,
Dr.
definitely.
Bhatia team that what should I do now?
Yeah, surely. We'll happy to help you out in this. So, Dr. Pandey, we just want to share your journey with the students who are watching this video right now. Like, when did you
Yes, sir.
started your preparation? And like you just said, you joined Dr. Bhatia Medical Institute. So, when did you join? And what was the approach in your mind when you joined this Bhatia Medical Institute?
Sir, I
Just
joined
yeah,
Dr. Bhatia Medical Institute when I was in second prof.
second prof.
But
Okay,
right now, at that time, I was not that sure. Matlab, I always wanted to clear NEET PG in the first attempt, but at that time, I was not that thing in my mind that I have to start preparing for the NEET PG. That time, my goal was to just clear my concepts so that it can get easy for me. Because everyone knows that first year and second year subjects hold a lot of importance. So
yeah,
that time, my goal was just to clear my concepts, not very much. But in third year, I started preparing for. Matlab, I was very much NEET PG focused when I came in third prof. So I attended all of the because at that time COVID was on its peak, so
yeah,
live classes were totally off.
yeah.
So through the online classes, I completed all my subjects in third prof.
Okay.
And because I will complete my subjects in third prof and fourth prof, and internship would be just to revise and revise.
Okay.
That
So,
was my approach.
okay, and during internship, you just revise everything, whatever you have.
Yes, sir. I was revising and I was giving T&D and subject test, grant test. That was all my approach.
Okay, so apart from these regular classes, what else you have joined in Bhatia? Like which other subjects, which other kind of courses you have
Sir,
subscribed?
I don't think so. There is any program in Bhatia that I have not joined.
That's very
I
good.
have enrolled for Vibe as well. I have given all of the Bhatia GTs and the T&Ds. I have also enrolled for the GCLT, and even I also attended this one-shot revision program that came live when the NEET was postponed. It helped me a lot. I gave all of the one-shot revision program tests and I reviewed them, and I found them very helpful because they were very concise and very like real life exam. The questions were like very from the very important topics, so that helped me a lot.
Right. So, Dr. Pranjali, like you have just mentioned, you have joined almost all our Bhatia courses, right?
Yes, sir.
So when you're preparing for the exam, like you started from like right from the second year, third, fourth, like there's a journey of around 3 to 4 years for you, right?
Yes, sir.
So like you must be getting some diversion in between also. Maybe
Yes,
like
sir.
there are many other platforms which are also offering these kind of courses, and your friends may be joining those courses and they're telling you,
Yes, sir.
apparently this course is better, that course is better, and you're also seeing the advertisements on the social media. So, what do you suggest to the juniors who are watching this video right now? Like, when you joined some institute, should you focus to the same institute, or like in case you get such kind of diversion, so what should your approach at that time?
Sir, I feel that before making a decision, we should we should do a thorough research. But when once we have made a decision, we should stick to it. Because personally, I don't feel so. There is any point in jumping institutions, reading this notes from there and also notes from other institutions. I don't think so. There is the point because I feel that whatever the institute is, the teacher gives 100% to ourselves. There's
Sure.
no teacher that we need to doubt that this teacher may not be enough, the notes might not be enough.
Yeah.
So my decision is before joining Bhatia, I would tell truth. I have done my thorough research. I contacted my seniors, my super seniors, everyone that I can contact. I even visited the Bhatia Center and the other institute centers. So once I was very sure in my mind that I have to join Dr. Bhatia, after that I was very clear that I'm not going to go for the diversion. I will completely focus on one institute. I will give their tests, I will give their exams, and I will continue my journey.
So this is a very important thing which Dr. Panjali has just mentioned, that whatever institute any student will join, the student should trust the institute. The student should trust the teachers of that institute because everybody is giving the best of them, right? So once you trust them, once you follow them, then definitely the path is going to be more clearer and the divergence will not be there. Right. And Dr. Pranjali, like when you're preparing for the exam, you must be having some negative thoughts in between also, because every
Sir, a
student has
lot.
yes, I know that. So how you overcome those obstacles, right? Because whenever we go for such a big target, whenever we have these negative thoughts, there must be some zeal inside present in our body, and there is something present in us that will keep us going on. So what
Yes,
is
sir.
that motivation that you always keep in your mind whenever you get such kind of low moods or kind of a low phase in your life?
Sir, the thing is that I wanted to share an experience. In 12th class, I very with deep in my thought, I wanted to join AIMS Delhi, but I couldn't because I couldn't get that much rank. But I was very happy with Safdarjung, VMC Safdarjung. But this time I had that zeal in mind. Ki, no, this time I have to prove myself. Whatever the reason is, I have to prove myself. What I couldn't do 5 years back, I have to do this now. That's why. So whenever I felt the low, I was like, no, you have to do this. This is your time. This is your chance, and you have to do this.
Yeah, that's a thing. So and Dr. Finally, one thing more, like whenever somebody got successful, there is a effort of so many people behind him or her,
Yes,
right?
sir.
So if I ask you this question, the one person to whom you want to dedicate this, I know like Bhatia has played an important role. That's a professional
Yes,
thing.
sir.
But on the personal front, like if I ask you this question, to whom you want to give this credit? Is it your parents, your friends, your siblings? Like who is this person?
Sir, actually, there are two people. I can't choose between them. One
Okay.
is my father. Sir, matlab, literally, my father is like a pillar for me.
Yeah, sure.
I know that whatever the problem is, whenever I'm emotional, I just contact him, and he says very simple things, and it just makes everything all right.
Yeah,
And next is a very close friend of mine. That person has stood by me for the whole journey.
yeah.
That's why. So, because I'm a very emotionally vulnerable person. Whenever my rank gets down, my score gets down in the GPs, I was like, no, matlab nahi ho raha hai, nahi ho payega. But
Mm.
whenever I contacted these two people, it was like, nahi, you can do this. You have the potential. Their faith just got me going.
So when you shared your rank with them, like first time with your father or with your friend, so like, can you explain like what kind of feelings, like how they have reacted to this rank when you have shared the result with you? I just want to
so,
know about their feelings
so
because they are
actually,
such an important person in your life. Yeah,
they both started crying. Then literally they both started crying. They were
yeah.
like, we don't have anything to say, but they were just crying. They were in tears. And they're
Okay.
like, we are so, so proud of you, so proud of you. Like they are still like, I came home today, just an hour back. My father was like, you have done this. You have
Mhm.
made me so proud. You have made me so proud. And that was like the best feeling for me.
Yeah, this is what every student should understand who is watching this video right now, that we should make our parents proud because these parents or the friends are the persons who are actually are the well-wishers for us. So, like, if we really get successful and we give this present to them, like, they are the one who really get happy with this. So, that's really fine. And like you have just mentioned between about the GTs, like, whenever your score gets low in GT, so I just want to know, like, how to approach this thing. Like, when you're giving the GT exam, you're getting the less rank, you're not getting the rank which is your expectation, and how you analyze yourself after this getting a low rank in one GT and how you improve.
Sir,
Yeah.
so my approach was very simple because I thought the GT review is the most important. It is more important than giving GT. I used to spend like 2-3 hours on proper analysis of my GT. I used to mark the notes that what is my silly mistake, what I can improve, or what
Hmm.
is my conceptual mistake. And
Okay.
whatever my mistakes were, I used to, if there is any explanation, I used to read the thorough explanation, and then I used to read that part from my notes also, so that I can concise is better. And I used to mark those topics that I have done wrong questions from this. I have forgotten this topic so that I can revise it whenever I want.
Okay. And Dr. Pranjali, if any student is starting right now from the first or maybe the second year for his NEET PG exam, so what do you suggest? Like while doing first or second year courses for the in DBMCI or any other platform, the students should also do MCQ side by side, or like he should start doing MCQs in when he enters the third year. What is the approach like? What do you
Uh,
suggest?
Sir, I feel on my personal level that doing MCQs
Mhm.
is very important. It
Yeah.
gives us the idea to how to approach and question, and it
Mhm.
also gives us an idea about our time management. So
Mhm.
I feel that you should start doing MCQs as early you can, as early you're confident enough to do the MCQs.
So, like, so what do you say? Like, if the student is in second year, he should complete all first and second year subjects up till the completion of second year only, and then in third year he should pick up the third year subjects, then the fourth year in fourth year final subjects. Or is there
Yes, sir.
any other permutation combination of the subject that student should follow?
Uh, No, sir, I think that this is the best permutation combination because first and second year subjects are quite lengthy. They are
Yeah,
not the short subjects that we can do
sure,
in just a day
definitely.
or two. And
Mhm.
I think that first and second year subjects are very conceptual and they are like the building blocks. You can see the subject like pathology, anatomy. They are
Yeah.
very important for medicine, surgery. So I think that in first and second year, the student should make their basic concepts very strong so that they can do the fourth year subjects like medical surgery better in third year. Because if they start doing in second year all of the subjects, I don't think so key concepts would be that much stronger that are necessary for the future subjects.
So up till second year, the student should finish the six subjects with all MCQs. In third
Yes,
year,
sir.
he should do the three subjects only, right? According to you, or should the student should include some medicine or surgical part in that also?
Sir, I think the students can induce add the subjects if they have done the third year subjects very good, because I don't think so there is any point of rushing and doing the complete just completing the subjects for the sake of completing it. I
Mhm.
think the subject you have done, you should be clear enough, the concept should be clear enough so that you can move on to the next part.
Okay, right. And Dr. Panali, there are many students who may not have got the rank of their expectation. So they may be watching this video. So what do you suggest them? Like whether, like what should be their approach now? Because I have spoken to so many students since yesterday, and many of them not got the rank so that they will get some good seats or some clinical seat even. So they are now planning to target the INCT in November AIMS exam, right? So what's your suggestion to them? Like, because they have already completed their syllabus, they have already revised everything, they have done this GTs, they have done everything, like maximum efforts they have already been given, but still they have not got the rank. So what do you suggest them? Like where, what, like it's totally your opinion, like where they are lagging and how they can improve this and they can clear the exam in November AIMS.
So I think that at this point of time, doing as much as questions and GTs is
Okay.
the most important thing, because in my preparation
Hmm.
in the last month and from since May only, I started giving 2 or 3 GTs a week, and my main focus was just to give the GT, review the GT, give the GT, review the GT,
Means last
and do
month you
as
have given 2 or 3 GDs per week, right?
yes, sir.
Okay, okay. Then please continue. Yeah, yeah.
I think that giving GTs at this point is most important, because that will give you an approach, that how to approach the question and how to approach the question. So
Okay.
I would actually, I don't think so I'm an expert, but I can
Yeah,
just give my
I was just
opinion.
taking your opinion because you have got such an amazing rank. So there must be a special thing in you that you must have put in your preparation. So the students may be looking for that, and they're
Yes, sir.
looking forward to you. Like you, if you advise them, they can also follow that, and they can
Uh,
also get a good rank out of it.
uh, so my opinion was just to give do as much as any questions I can do, and give as
Okay.
much as GTs I can do, because I thought ki in internship I have done enough revision.
Okay.
And
And how many times you have done the revision in internship? I mean, just
sir,
one idea. 3 times, 4 times, yeah.
sir, till March, I think I have done the revision like 4 times.
Till March. Okay.
Yes, sir. So after that, I thought ki this doing revision again and again was not giving that much progress that I needed to do. So I realized that I need to do the questions more. So I increased my daily questions. First, I increased my daily questions to 150. Then I increased them to 200. So I was giving daily. I was doing questions daily, and I was giving GTs like 2 or 3 times a week. So I think that helped me a lot to increase my score.
Okay, surely, surely. And one thing more, like you have started this journey since when you were in second year, right? And you
Yes, sir.
must have made notes in second year of the first and
Yes,
second
sir.
subjects. And by the time you will reach the internship, there may be many changes in like that, because like I teach pharma, so I know that there are many changes in pharma which occurs every year, right?
Yes,
So
sir.
how do you update your notes? Like how the student should update his or her notes when he's preparing for such a
Uh,
for entrance exam, right?
Sir, I to totally trust my teachers, because I have followed all of my teachers on Telegram, on Instagram, Facebook,
Mhm.
and I've seen that whenever any update comes, the teacher updates that on Facebook, Instagram, everything. So I used to note that update from the platform only, or from the different platforms, or in Telegram. The teachers are used to upload every update. There's
Okay.
I don't follow any other method. I just used to trust my teachers.
And also, Dr. Mani, you must have noticed, like when given the exam now, they're not asking many updates these days. Like they're
Yes,
giving
sir.
the clinical questions, they ask the basic things, and they just want to know that as a student, you should be knowing how to deal the person in OPDs and in real life scenarios. So
Yes, sir.
instead of asking any many hi-fi things and many, I mean, difficult new concepts which are yet to be uh, published in the textbook, they're not asking those things. So even you're getting a basic knowledge and having the decent updates which have occurred around 2 or 3 years back, that's I think fine enough these days in the exam.
Absolutely, sir. Absolutely.
Right, right. And Dr. Pandey, just to wind up this session, I just want to know, like now you are, I think today you are on off day, right? After this
Yes,
off
sir.
day duty. So what's your next plan for next 2 or 3 days now?
Sir, actually, I have taken the leave for the
Okay,
next 2 3 days, because
very
now
good.
I just want to spend this time with my family.
Okay, this is
So
best thing.
yeah, that's why I've taken 2 3 days leave. Then I'm planning, because I think now I will join Delhi back only. I will join my original college. I will take a seat from Safdarjung Hospital only. So I'm planning to resign my AIMS seat. I'll
Okay.
do that
And that's
in a day
always
or
good.
two.
Even we suggest the students to always take the seat if there is a possibility and you're getting a deemed branch. So it's better to take the seats in your state only. So
Mm.
it's always good. It's more convenient, and also finally you have to get settled down in your state only. You have to work over there. So if you are familiar with the environment, that's always good for you.
Yes, sir.
That's really nice talking to Dr. Pranjali, and thanks for guiding all the juniors and all the students who are listening this and watching this video right now. And again, a very big congrats to you and your family, and give my regards to your family members.
Thank you so much, sir. Thank you so much.
Thank you. Thank you, Dr. Malvi, sparing us time.